to see you.
Good to see you.
So we're talking about hormones today. This is such an exciting topic for both men and women. But again, just before we start, I wanted to make sure that everybody knows that this is for informational purposes only, and we are not intending to make any claims or diagnoses or any suggestions to indicate that we are treating anybody here, okay? So this is all informational. Please make sure that you seek your medical professional for your personal conditions. So, Dr. Marian, hormones and the art of hormone balancing. This is an incredible, complex topic. So many hormones, so many glands involved, and it's truly an art to synchronize all of these hormones, right?
Yes.
It's truly an art. And it makes it a little bit more complex for females that are going through their cycle, because it seems like half the cycle is one thing and half the cycle is another. And it gets even more complex when we are going through menopause. And the hormones are 1 minute like this, another minute another way. So where do we start? That's the ticket, right?
Yes.
Where do we start? So what are hormones?
So hormones are basically messengers that the body uses to send information from one area of the body to another. And so, for example, you might get a message from the pituitary gland, which is in your brain, down to the ovaries. And it's essentially giving us information, or giving the organs of the body information about where we should be in our cycle, or about what needs to happen. Obviously, there's a multitude of hormone actions, so that information can be anything from produce more hormone, or produce less hormone, or ovulate, and so forth. So basically little messengers from one area to another.
And so why is it that we need to balance hormones? Why are we even talking about this, right? So I think that's a really good question to ask, because most of us are looking for longevity. We're looking for a healthier lifestyle. We're looking for better function mentally, physically, emotionally, energetically. We're looking at all of these different systems in our body we want to optimize. And hormones have their little fingers in every single system in our body, right? Including the digestion, our brain and memory, our nervous system, our blood, our muscles, our skin. I mean, the whole system is really run by the intricacy of the signals and the balance that happens within these hormones and between the hormones. So when these systems go out of balance, when these hormones are out of balance, is when we start having symptoms like PMS, like breast tenderness and bloating and mood swings and memory loss and pregnancy brain and depression and anxiety and skin wrinkles and skin rashes. And I mean, the list can go on and on and on. Sleep issues, right?
Yeah.
So these systems are affecting us in so many, many ways. And it gets becomes quite art to figure the system out. Mm-hmm. So is there something that pinpoints for you where to start?
Yeah, so, well, we use a lot of testing, of course, to see biochemically what's going on with the hormones, and that gives us hard data to work with. But we also do very thorough clinical history taking. So a lot of times your symptoms in themselves can tell us exactly, or at least closely, what might be going on with hormones. And actually, I have a bit of, well, this is one of my bones to pick with conventional medicine, but conventionally, women will go to a medical doctor with really any variety of menstrual complaint. It could be heavy bleeding, or menstrual cramps, or moodiness, or irritability, or long menstrual cycles, or short menstrual cycles. And by and large, for each of those occasions, they're given birth control. And I really have a bone to pick with this because birth control is not the solution to those things. And I want women to know that they are inherently, and actually not just women, but all people, you're inherently perfect. And if we are able to identify the reason that those hormones are in imbalance, the reason that you're having cramps or heavy bleeding and so forth, then we can resolve those issues naturally without giving you exogenous synthetic hormones, as with birth control, which have a lot of downside. So that's just one of my bones to pick, but that gives you an idea of when we start to talk to a woman about what they might be experiencing hormonally. A lot of those symptoms will give us clues, and that they really are your body giving you clues about what could be going on and how that needs to be addressed. There's so many things that can affect hormones, such as diet, environmental toxins, infections, and so forth. So finding those reasons or those causes are really important to address so that other systems don't also get affected.
That definitely. And, I'm using this mic because I think Facebook guys are having a hard time hearing you. So I'm going to bring this up to you, Mike, so they can hopefully hear you. The other interesting aspect of all this is the aging process, right? Mm-hmm. Because, you guys are not there, but we're there. We're over that 50 mark. And one of the things that a lot of us look for is to slow down the aging process. And telomeres, which are basically the little caps that sit on the chromosomes in our DNA, as they shorten, as we age, they slow down, or they increase the aging process, right? So the longer they are, the slower the aging process is. And that's one of the things that hormones actually affect, is that the studies are showing that when there is proper amounts of testosterone, proper amounts of estrogen and progesterone, then the telomere length does not lose its length as quickly, and it's maintained, and therefore this aging process is slowed down. And that is really exciting information to know about, that we can actually slow down the aging process by using hormones that are bioidentical. We're not talking about synthetic hormones. We're talking about bioidentical hormones, and keeping them in balance in order to maintain or slow down the aging, because it's all about graceful aging, right? It's not about anti-aging, it's about graceful aging. Yes. And the connotations with that are that as we slow down the aging, we are slowing down the risks for chronic disease, like heart disease and cancer and diabetes and chronic pain and neurological diseases. In fact, the studies have been showing that when there's good amounts of estrogen in the brain, for men and women, that the risk of Alzheimer's and dementia goes down, right? So there is a lot of studies that are coming out in respect to what these hormones are actually doing in benefiting us. And so it is really important, I can't emphasize that we need to make sure that the hormones are balanced. Yes. Now, one of the things that I always look at when it comes to hormones is insulin. That's actually one of the very, very first things I look at is insulin. Do you want to talk to us about insulin a little bit, doctor?
Yeah, absolutely. So insulin is a storage hormone. And what that means is that when you have high insulin in the body, your body is getting ready to store energy. And it does that in the form of adipose tissue for the large part. And so if insulin is high, you're storing, you're not going to be burning fuel for energy. So you won't be burning fat. We see high insulin in diabetes and prediabetes and metabolic syndrome and any sort of blood sugar dysregulation. When you eat a carbohydrate, especially simple carbohydrate, sugar, that type of thing, your insulin spikes, and that allows you to absorb that energy, that glucose, into your cells. Basically, insulin docks there, and that allows to bring in the glucose. And so it's a storage molecule. And For the most part, we want insulin to be as low as possible, but we don't want it to be zero because we need it in order to use fuel, to use glucose as energy. But you don't want it to be high or dysregulated because that can lead to obviously blood sugar dysregulation and diabetes and so forth. I could probably go on and on about insulin, but
well, one of the main reasons I look at insulin is because when our insulin does spike and goes up and increases our risk for diabetes and all of the other inflammatory conditions, that it actually reduces testosterone levels both in men and women. And testosterone is extremely important for libido, for this general sense of well-being, for our brains to function better, for being able to make decisions. So if you find yourself being very indecisive, then you're most likely low in testosterone. For muscle mass and fat burning abilities of the testosterone. So insulin, as it goes up, the testosterone levels do come down. And same with estrogen. The estrogen is impacted by the levels of insulin, and so is progesterone. In fact, if progesterone is too high or too low, it will affect insulin. It will make the insulin go up and promotes insulin resistance. But at the same time, if insulin is too high, then it will reduce your progesterone levels and estrogen levels. So there is this really beautiful balance that goes on between insulin and these sex hormones that we need for our general well-being, for transitioning through menopause, for PMS symptoms, for fertility, and for all of that. So insulin is really, really important. And the problem with insulin is that most of the time we are not able to recognize that we are actually insulin imbalanced, right? We don't recognize it until we're in our 40s or 50s or 60s, and then suddenly we are diagnosed with diabetes. And one of the symptoms for insulin resistance is, number one, is actually waking up in the middle of the night. If you're waking up, your blood sugar, and there's no reason for it, right? Your blood sugar is most likely dropping, and then the cortisol signals to bring up the blood sugar, and the blood sugar goes up, and then, so that wakes you up, and then the insulin comes up in order to shut down the blood sugar, bring it back down to regulation. So if you're waking up in the middle of the night, it's very often an insulin or blood sugar dysregulation issue that's going on that needs to be addressed. Other symptoms can be just weight gain, especially around the abdomen. That is an insulin resistance issue.
And upper back.
Say that again?
Oh, back fat, upper back fat.
Yes, upper back fat. Great, is another sign of insulin resistance. And so these symptoms can indicate that you're starting to have insulin resistance, and we should really address it before it creates a lot of drama with all the other hormones. So how does stress play in all of this, Doc?
So stress, again, the big stress word. Stress, of course, in the body is experienced as an increase in cortisol most of the time. Even mental stress, emotional stress, physical stress, environmental stress, all of those things will lead to an increase in cortisol. And what cortisol is going to do, we call it the pregnenolone steal. But basically, pregnenolone is our master hormone. And from pregnenolone, we make all of the other hormones, at least as far as estrogen, progesterone, DHEA, testosterone, and cortisol go. So you can imagine if you're very stressed, your body's going to be increasing just one of those, just cortisol. So it's going to be swallowing up all of that pregnenolone, which comes from cholesterol, and then funneling it down into cortisol. So what you're going to find is that there's high cortisol, which has its own negative effects, and I'll get into that in just a sec. You're going to find low estrogen, low progesterone, low DHEA, and low testosterone. And that high cortisol is going to lead to blood sugar dysregulation by way of increasing glucose in the body, because when you're running from a bear, for example, evolutionarily, we needed fuel for our muscles to do that. So if you go into a stress state, a stress response, your body floods the bloodstream with glucose so that you have the fuel to run from a bear. But the problem with that is that in modern day, we get stressed sitting in front of our computer or watching the TV, watching a horror movie, or, you know, just being really sedentary. And so we're flooding our body with glucose in order to run, but we're not running. We're actually just sitting there and becoming more stressed out. And so that high glucose in the blood maintains that level because we're not using it. Our muscles aren't absorbing it by running. And that leads to ultimately insulin resistance, because that long period of high glucose will then lead to insulin resistance because it's just staying high and not using it. So it's sort of like a big circle. I mean, when we look at these things, we have to look at both the cause and the effect, the downstream effects and the intermediate and the primary effects. And it is just one big vicious cycle. But if you can shift it into balance, it can be a very beautiful, balanced, and human engineered cycle instead of chaos.
Definitely. And you know, some of the symptoms that we see that may be misinterpreted as being other hormone issues for high cortisol is the low muscle mass and the big belly, right? Because cortisol is a hormone that breaks muscle down. And so it's harder to keep your muscle mass if you are high cortisol and high insulin. And then that also then reduces your testosterone levels and the progesterone and all the other things. And then it has this dominant effect, like you were saying, throughout the whole system. So the thyroid is another one that we haven't really focused in yet. So the thyroid hormone is something that sits right here. This is the gland that sits right in front of our throat, and it's like a little heart shape like that.
Butterfly.
This gland is a very powerful gland because it is involved with our metabolism, with our energy, with our digestion, with the effects that it has on the adrenal hormones, the cortisol, the stress hormones, as well as the other hormones. And so oftentimes we need to make sure that the thyroid is working in balance and producing enough hormones. Now the difficulty becomes with testing and diagnosing hormone malfunction, because the blood tests are looking only at the hormone levels for thyroid in the blood. And the majority of the active hormone, which is called T3, is produced in the tissues, so in your cells. So the thyroid here produces something called T4. That's its hormone. It's not a very active hormone. It produces a little bit of T3, but mostly T4. And then T4 travels to your tissues through the blood, and then it converts to T3, the active form, and that's where it is doing its work with your metabolism and energy and everything else. Now, when we are just evaluating the blood for this hormones, we're just looking at what's circulating in the blood and not what's at the tissue level. And that's where the problem begins, because we may show proper amounts of hormone production from the thyroid, but the conversion from T4 to T3 at the tissue level is not happening. And that is where you start getting the thyroid, hypothyroid or low thyroid symptoms, because you don't have enough T3 conversion happening at the tissues. So what helps the conversion of T4 to T3? That's what we need to look at. We also need to look at symptoms. We also need to look at functional tests to see what the thyroid levels are doing, and multiple other tests to look at the thyroid. So it's a complicated diagnosis to make, but once the diagnosis is made, then people feel much better energetically. The weight is more stabilized. The skin health is not as dry. The hair is not falling out. There's no IBS type of symptoms going on. No constipation stuff going on. Mental brain fog lifts. So this becomes really a very, very important gland to look at.
Yeah, so the labs that we often will look at for thyroid include a number of things, and conventionally they may just look at TSH, because that's the message from your brain to your thyroid to make more thyroid hormone, and conventionally they use that as an indicator, because in their understanding, if you're low thyroid, that'll be high, and if you're high thyroid, that'll be low. But there, as Dr. Darvish was mentioning, there's a lot more nuance to it. It's actually TRH that goes from the hypothalamus to the pituitary, and then from the pituitary to the thyroid, that's TSH. And then like Dr. Darvish mentioned, there's T4 that is produced mainly by the thyroid and a little bit of T3. So when we look at labs for the thyroid, we will look at TSH, free T3, free T4, reverse T3, and in some case thyroid antibodies, because often even all four of those thyroid lab numbers will be somewhat within normal limits, but then there's actually an autoimmune reaction going on against the thyroid. So sometimes we'll look at thyroid antibodies as well, because there can be a slight functional lower thyroid function that is caused by an autoimmune reaction. So you really, when you are looking at thyroid function, you want to look at all of those numbers, because that's important to see where the T4 is, where the T3 is, and so forth, and then start to identify where in the process is getting hung up.
I'm glad you brought up the pituitary gland, because the pituitary gland is an incredibly important gland in the body. It sits right behind the eyes in the brain, right? And it's surrounded by bone. And the space between the bone and the gland is just minuscule. It's very, very tiny amounts. What that means is that if there is a head injury, let's say you had a concussion or a head trauma in a car accident, or even balling, hitting the ball.
Soccer, yeah.
With soccer, right? Anything that kind of does this to your head, which not only can injure the neck, by the way, but it can shift the bones of the skull. And as the bones of the skull are shifting, it can impinge the pituitary gland, and the secretion from the pituitary gland becomes dysregulated. And that is where we get a lot of other issues showing up with hormones, maybe 20, 30 years later. So for instance, men who are typically football players or soccer players, the girls, may not show any hormonal imbalance after a head injury, but later, 20, 30, in their 40s and 50s, they start having memory issues or brain fog, concentration issues, and then all the other hormones are declining much faster than expected. And it is just because the injury to the pituitary gland was not addressed early on. It is something that we can still address, but of course it's going to take much longer to address. So I do caution all of those adults and kids who are playing these kind of games, or who do have a car accident or a head injury of some sort, no matter how mild it may be, that you get your skull bones evaluated and treated by a specialist who works with the skull bones specifically. And we do that. We have a couple of doctors here who do that. We also have other specialized chiropractors who we refer to that do that kind of work. So it is really, really important. The pituitary gland secretes multiple hormones, one of them being the thyroid signaling hormone, but it also signals to the ovaries to produce their estrogen and progesterone, and the testicles to produce their testosterone, to the adrenals to deal with stress. And one of the more important hormones that it secretes is the growth hormone. And the growth hormone is extremely active during nighttime, because it allows for repair and regeneration and healing of tissues. We often think of the growth hormone being really important with kids because it allows them to grow, but it's just as important for adults, because it can shift things with your muscle mass, your pain. So a lot of patients with chronic pain and fibromyalgia may actually have a growth hormone deficiency issue. It affects your mood and anxiety and depression, and the list goes on. And it's not just head injuries that will cause a deficiency in growth hormone. Tumors can do that. Malnutrition, not getting enough amino acids and protein and your vitamins and minerals in your diet, especially as a teenager and growing into your adult years, can cause growth hormone deficiency later. So there's multiple reasons that growth hormone can go down. And again, it's one of those hormones that is very difficult to diagnose through blood tests, even though we measure it through blood tests, because most of the activity of the growth hormone happens at the liver and the tissue level to do its work for fat burning and insulin balance and all of the other systems that are so complicatedly involved in our body. So there is a comment here about how this individual had their thyroid act up after they had a concussion from a car accident. And that is, that again goes back to the pituitary gland. To have somebody look at your pituitary gland and look at the function along with the other hormones and see what's going on with the pituitary and address that.
The other thing that can happen, just to add to that, with concussions is that in 100% of concussions, immediately following, there will be leaky gut. So because of the communication, the two-way communication between the brain and the gut, when the brain gets inflamed, even mild concussions will cause, to some extent, leaky gut for a period of time afterwards. And so it's important to then look into the gut. And we already had a whole visit aimed around the gut health, but that's just as an aside, because concussions can really affect the gut health. And then I also just wanted to add, actually, with hypopituitarism, which is the term that we use for an underfunctioning pituitary gland, both anterior and posterior pituitary gland, is that infections and environmental toxicity can really cause that. So fungal and bacterial chronic sinus infections will create toxins in the sinus that then go directly to the brain and really just right about at the pituitary gland. And that across the board just wipes out all of your hormones, because that's the command center that is sending those little messengers to the rest of the body to promote estrogen, progesterone, cortisol, testosterone, etc. So if there's an infection in there, there's toxins being made, and that can create low hormones. And then the same goes again for the teeth. And I really just love to harp on people about their dental health, but root canals, metal, silver, amalgam fillings, and dental infections will also lead to toxins going straight up into the brain and then wiping out hormones. So there's often things that we want to look at, causative factors that need to be resolved in order to find out why your body's not making the hormones it should. Because again, your body is engineered as a perfect body. It should be able to produce these things, and we just want to find out why it's not doing that.
Thank you so much. Yes, and I'm glad you brought up the guts and the microbiome. We talked about it a little bit last week, but I wanted to also point that out, because there's two main systems that I look at when the hormones are going haywire, right? One is the liver, and one is the gut microbiome. And the reason both of those are so important is because the toxins from the hormones, when the hormones are produced, let's say your estrogen is produced, you've got 3 different forms of estrogen. I call them the good, the bad, and the ugly, right? The good guy is what we call estriol, or E3, and it's produced mainly before menopause by our ovaries. And that E3 is very protective. It's anti-cancer, and that's one of the reasons we see less cancer in the premenopause females than in the postmenopause females. Now, E3 is something that may not be produced as much if there's some genetic SNPs going on in your system. Now, E2 is what we call the mediocre one, or the bad guy, because it can become E3, which is the good guy, or it can be converted to E1, the ugly guy. The ugly guy, E1, is known as estrone. And E1 estrogen is the most cancer-causing, the most inflammatory, the most toxic. Now, these 3 estrogens that our body produces, by the way, E1, the most toxic one, is produced by our fat cells. And E1 is more common after menopause. So that's why we have more cancer-related or hormone-related cancers post-menopause, because we are producing a lot more E1 from our fat. And that is another reason why it's so important to maintain exercise and our body fat and our diet in comparison to our muscle, so that we reduce the E1 production post menopause as well as andropause. So both men and women will produce more E1 after the hormones have kind of cessated. That's the other reason why you see men and women kind of have a similar body shape as they get in their 70s and 80s, is because the estrogen level, the E1 level has gone up, and more fat has gone up, and it's suppressing all the other hormones, including the progesterone and testosterone. So when you've got these three hormones of estrogen, they have to be processed through the liver. And if they're not getting properly processed through the liver, then you're going to produce more toxic estrogens, byproducts, metabolites, and those are even more damaging to our DNA and create more risk for cancer and inflammation. So liver becomes a really big deal in the way we handle and balance hormones within our body. And thus, if liver is not clean, if it's stressed by toxins like glyphosate, chemicals in our food, pesticides, herbicides, when it's, pardon? Viruses, infections, heavy metals, alcohol, wine, and multiple other causes of liver toxicity can slow down the detoxification of these estrogens and many other hormones and lead to more inflammation and create more out of balance hormones throughout our system. The other aspect of it is the microbiome, the gut. The gut is very, very important because the bacteria in the gut, there's actually a whole load of special bacteria that balance estrogens, and they're called the estrobolome, right? So there are these bacteria that process these hormones. And when you are drinking chlorinated water, for instance, or taking a lot of antibiotics, or eating non-organic foods with the pesticides and herbicides. By the way, think of pesticides and herbicides as an antibiotic, right? So what that means is that every time you're drinking chlorinated or tap water, you're taking in food with these chemicals in it, you're actually damaging the microbiome. It's breaking the microbiome, the good bacteria down, and as a result, it's going to lead to more estrogen toxicity and hormonal imbalance. So how do we increase E3? That's one of the questions that's coming up, Doc.
Mm-hmm. So depending on the age of the person, we might use different tools to increase E3. For example, postmenopausally, in some cases, we will actually use bioidentical hormones to boost E3, and that is because with aging, E3 tends to reduce. In younger women, we try to promote better estrogen production and regulation. Rare cases, we might use bioidentical hormones pre-menopausally, but those are rare cases. And so we will look at the diet, we will look at the microbiome, we will look at the liver and look at where in the process the body's getting hung up and see what we can do to produce and shift things more towards E3. Do you have anything to add to that? I feel like there's probably
Well,
more.
again, doing whatever it takes to detoxify that liver,
Yeah.
right? Because the genetic SNP that can happen in production of E3 is also one that is affected by the liver. So it's really important, again, to keep that liver very, very healthy. Exercise becomes very important. Low sugar, low fat, low animal fat.
Reducing adiposity, yeah.
Yes.
Reducing your own fat.
Exactly. So managing the weight, reducing that insulin level, reducing stress and cortisol. Stress. These are all ways of producing more E3 and reducing the other toxic estrogens. But more importantly, we want to increase the good estrogen metabolites, which are produced as a function of a healthier liver, right? So foods that increase the good estrogen metabolites are like the cruciferous vegetables.
Yeah.
We're looking at broccoli. One of my favorite is arugula. It's kind of funny, you know, as I've been going through this hormonal shift and menopause, that I've been craving arugula.
Mm-hmm.
And I'm like, why am I craving arugula? And then I realized, because it helps reduce the toxic estrogens in our body and promote the healthier ones. It helps my liver detoxify the toxins and, again, produce better hormones.
Mm-hmm.
So arugula is a really great one. Kale, chard.
My friends make fun of me because I will eat an entire mountain of broccoli or cauliflower, and when they ask me, like, what do you feel like, what are you craving, it's almost always broccoli or cauliflower, and I get made fun of because it's never anything else.
It's for that hormone production imbalance.
Yep. It's helping.
My body kind of intuitively knows that, right?
Yeah.
And then increasing your liver foods like lemon and water before your meals to stimulate the liver to detox its bile, release its bile through the gallbladder. Then we've got carrots and artichoke and beets. All of these great vegetables, especially the root vegetables, are great for detoxifying the liver. And, leading a good, healthy lifestyle, getting to bed on time before 11 o'clock, because 11 to 2 is the liver time, really, liver and gallbladder time for the body to regenerate and detoxify the toxins during the day. So getting to bed before 10 o'clock is going to be very important. Exercising and oxygenating the cells. In fact, one of the treatments we use here frequently for hormone balancing is ozone therapy, because ozone oxygenates our blood, and it helps. There's studies from Europe that have shown that it helps balance those hormones and help the liver. It upgrades the detoxification system in the liver and helps the liver get rid of the toxins that it needs to through upgrading what's called the glutathione system.
Yeah,
so
that's going to clear out some of those infections too, right? Like
yes,
the viruses and other things that are causing the hypopituitarism, the low hormone. So it's kind of a dual action, dual bonus, or dual benefit.
Yes. So that's estrogen. Progesterone is the other hormone that I love talking about, because progesterone, number one, is like you alluded to, pregnenolone is our master. I call it the grandmother of all the hormones, right? It's produced by the cholesterol, like Dr. Marion was mentioning. So we've got the pregnenolone, which is also our memory hormone. And it's one of those hormones that does go down as we get older. So if you're noticing that you're having memory issues, guys, girls, ladies, men and women, pregnenolone is low, right? So pregnenolone also helps us produce progesterone, and progesterone is important for our bone health, to keep the bones healthy from becoming osteoporotic. It helps our heart stay strong and reduces the risk for heart disease. It also helps our brain function, our memory, our skin, libido, energy. Like Dr. Marion mentioned, there is the pregnenolone steal, which, when your stress levels are high, the pregnenolone gets stolen and becomes part of the stress hormone system. But progesterone does the same thing. So there is something called progesterone steal. When you're under high stress, your progesterone is going to get burnt out and utilized by the stress hormones, so that your body can run through that fight and flight issue, right? So progesterone is very important. It also goes down with every pregnancy, whether you've had a full term or not. Even miscarriages will bring down progesterone. Around menopause, it's the first hormone to often go down. It goes down with stress, like we mentioned, premenstrually. So that's one of the reasons why we get PMS type of symptoms, mood swings, and breast tenderness, and bloating, and irritability. All of that is progesterone low. So men out there, when you see your woman having irritability and being short with you, you're going to tell her, hey, go get your progesterone checked. Right? So progesterone is vital to our mental and mood well-being.
Both men and women, right? Both men and women.
Yes, for both men and women. So anxiety can be a sign of progesterone deficiency. In fact, progesterone is very, very important for men. It's more important in many cases than testosterone is, because progesterone is required for sperm production, for testosterone production. If men don't have progesterone, they don't sleep well, their testosterone levels drop. And again, if they're under high stress, they're burning through their progesterone and then not producing the testosterone. Too often do I see men come in here and they've got low testosterone, and their conventional doctor put them on testosterone, and they're getting side effects from the testosterone, and nobody's looked at any of the other hormones, not their stress levels or stress hormones, not their thyroid, not their progesterone, pregnenolone, estrogen, none of that.
And they're giving them synthetic testosterone.
Exactly, and they're giving them synthetic testosterone, which does increase the risk for cancers and a bunch of other chronic inflammatory diseases.
Heart attack, stroke, clots of all kinds, cardiovascular disease.
Yes, yes. So progesterone becomes really important. Oftentimes when we do give progesterone to men, they sleep a lot better. They're not as stressed and anxious and impulsive, especially when they're going through their andropause time. You know, andropause can start for men from the age of 35 up to, 60, 65 years of age, to various degrees. So it is really important to have men look at all their hormones just as much as women get their hormones checked. So I want to talk a little bit quickly about estrogen and progesterone balance and that whole game, Doc.
Yeah, definitely.
Do you want to take over?
Yeah, absolutely. So, well, do you mean premenopausally or postmenopausally?
I mean estrogen dominance.
So, definitely. So estrogen dominance happens for a number of reasons. One of the biggest ones is obesity. And we've kind of touched on this, but insulin resistance and high levels of insulin will lead to estrogen dominance. But there's a lot of things that can lead to an imbalance between estrogen and progesterone. But estrogen isn't evil. As Dr. Darvish had mentioned earlier, it really is important for bone, for brain, for heart, for a lot of skin, a lot of different tissues. So you wanted that to be at the right level and in the right populations, right, between E1, E2, and E3. But premenopausally, estrogen should be a little bit higher in the first half of your cycle, generally between day 1 and day 14, which is usually when women ovulate. And then progesterone should be higher from day 15, roughly, to about day 28 when bleeding starts. And that balance is really important for the cycle to do what it needs to do premenopausally, which is ovulate, build a lining of the uterine, then shed the lining of the uterine, and then have a period and so forth, and for that to just keep going. And so looking at the balance between estrogen and progesterone is important to minimize PMS, cramping, bloating, irritability, depression, those sorts of symptoms. And there's a lot of things that we can just do very simply and naturally, such as something called seed cycling or oil cycling. And the reason that cycling of different seeds and oils is beneficial is that because the essential fatty acid, the omega content of, for example, sunflower seeds, fish oil, evening primrose oil, what kind of seeds? Sesame seeds that I'm probably missing. But the omega fatty acid is slightly different. The 3, 6, and 9 content slightly different. So the first half of your cycle, you want to promote estrogen, and the second half of your cycle, you want to promote progesterone. And we can do that obviously very naturally with seeds. And then if that's kind of too much of a burden, if you don't want to grind seeds every day, you can just take oils with fish oil and evening primrose oil. So that helps the estrogen to progesterone balance, at least premenopausally. Postmenopausally, we look at a lot of those factors: insulin resistance, diet, inflammation, environmental toxins, making sure there's no plastics in the diet, because those will lead to estrogen stimulation, and really any kind of endocrine disruptor actually can lead to estrogen dominance, and or actually just sit on the little estrogen receptor because your body thinks that this plastic molecule actually is an estrogen. So then it promotes estrogenic effects even if your estrogen isn't high. So that's another problem that we look at.
So great. Thank you for that. And just to add to that, estrogen dominance basically means that you've got too much estrogen compared to progesterone. And that can happen well, there's different scenarios. So you can have normal levels of progesterone and high levels of estrogen. You can have normal levels of estrogen and low levels of progesterone. You can have high levels of estrogen and low levels of progesterone, which is the most extreme. So all of these different cases are regarded to be estrogen dominance, and it leads to a more inflammatory condition in the body. Keep in mind that estrogen is a very much a tissue growth kind of a hormone. So it can cause cancers when it's too much estrogen compared to progesterone. This also happens in men very commonly, especially around high levels of stress long term, as well as after andropause or during andropause. So their estrogen levels go up, and that's one of the reasons men get man boobs or enlarged bellies, is because the estrogen is going up and the testosterone may not be up. The testosterone may actually be normal, and or may not be low. It may just be low, normal, but the estrogen level is up, and so it appears like they're low testosterone, but in reality, they are high in estrogen. So things like maca root is a great way to address some of the estrogen dominance in both men and women, and there's different grades of maca that do different things. So it's not just, you know, get the maca over the counter. There's 16 different varieties of maca, and each one of them will have an impact in concentrated form at different levels for different age groups on their estrogen and progesterone balance. Exercise, aerobic exercise, but not intense exercise. So if you're going to go for a walk or a little bit of an intermittent exercise or some yoga, something that will make you sweat is going to help that estrogen dominance come down. Sweating in an infrared sauna is one of my favorite things to do. And I highly, highly recommend sauna, infrared sauna, to burn the fats and the toxins inside the body and allow the skin to sweat it out. You don't get the same benefits with dry sauna or steam sauna. It doesn't penetrate enough. So infrared sauna is really one of the best ways to go. Hydration, drinking a lot of water, minerals, all of that is really, really helpful. Concentrated substances off of the broccoli and the cauliflower that you crave, carbinol or calcium D-glucarate. These are different supplements that we can give you or you can pick up to help the estrogen dominance in your system. And sometimes we cycle them, sometimes we don't, depending on the person. So, Dr. Marion, anything else you want to add before we take off? I know we've been talking a lot. It's been almost an hour. So what do you think?
Well, maybe just that there's the enzyme aromatase is the enzyme that converts testosterone to estrogen. So in both men and women, we'll often look to support that enzyme, or inhibit that enzyme to reduce some of that testosterone to estrogen conversion. And one of my favorite things that does that is white button mushrooms. You always want to eat mushrooms cooked. You don't want to eat them raw, but that is a great natural aromatase inhibitor, and also I don't recommend pharmaceutical aromatase inhibitor. There's lots of great natural options. But that's all. That was last thought.
You know, there's so much to talk about.
So much.
Hormones. It's so complicated, and we'll talk again at another session about hormones and get into the pancreas and the adrenals and all the other hormones that everybody's very much interested in. And it's very, very important to keep these things balanced for optimal health, for optimal aging, and for optimal mood and well-being. So again, thank you so much for joining us. We are going to have this recorded and hopefully posted. So those of you who have missed this should get a chance to be able to see it again. We also did a Zoom webinar that will be available on my site, drdarvish.com, hopefully before the end of the weekend, and it gives you much more detail, and you can kind of see the whole picture of all the things we talked about a little bit more systematically instead of us kind of answering questions and having a free flow session during this Q&A. So please do look that up. And you're always welcome to have a consultation either with myself or Dr. Marion or one of the other great doctors here at Holistique. You're welcome to go to Holistique Naturopathic and look us up there, or holistiquehealth.com on our website and check us out. And then, and I think that's about it. So I hope everybody has a great week, and we will see you next Thursday at noon for another Q&A live. Take care. Bye-bye.
Bye.